Okay, nutrition and pain. So today we're going to have a look at nutrition, but most importantly, look at how what you eat can affect your pain. So during this presentation, we want to show what the links are between diet and pain, why it might be important to make some changes to your diet, what effects diet can have on other comorbidities and your overall health. Many of the patients who come on our pain programs have goals around nutrition and weight loss. So this presentation might help you to start thinking about your own personal relevant goals that you want to work towards, what changes you might want to put into place to help you to achieve this. And if you think you already have quite a healthy diet, it might be interesting to explore what you're already doing and have a look at why nutrition interventions can have a significant effect on pain reduction. So we split the presentation into two. So this first section looks at links between diet and pain, and the second one looks at what changes you could be making.
Research has shown that a large population of patients who attend chronic pain programs are overweight. So this is up to 70% of patients. It also shows that an increase in pain can lead to increased weight gain. This is partly because the increased weight gain can lead to increased pressure on joints, causing more pain, and also increased inflammatory markers. It is therefore important to address this and try and break this vicious cycle. Patients with a BMI of greater than 30 are twice as likely to experience pain and have increased inflammatory markers than the general population.
So if we have a look at this slide, we're looking here at links between diet and pain and looking at what the research shows. So we know that pain can affect food choice. So pain can override hunger signals and can have a significant effect on your diet and nutrition. It can lead you to make poor food choices, so comfort eating, reaching for snacks to make yourself feel better. Moving down, decreased ability to plan ahead. So dealing with your pain might be more of a priority for you than food at the time. You might have more difficulty food shopping or unable to go food shopping. And decreased standing tolerance for cooking might mean you can't spend as much time in the kitchen cooking healthy food, and that can affect what you choose to eat. All of these things can lead to poorer quality of nutrition, and then your nutritional intake can influence your inflammatory response. So if you've got a poorer quality of nutrition, you're likely to get more pain, and pain also changes your nutritional requirements. During an acute episode of pain, we either eat less, so we don't consume all the nutrients we need, or we eat less healthily, which could be eating too much of saturated fats or a high sugar content.
So comorbidities linked to poor diet. So why is a healthy diet important? A higher quality, so a better diet, a healthier diet decreases your risk of mortality. But there's also a couple of other health conditions that are related to being overweight. And these are, it can increase your blood pressure, your cholesterol. Increases your risk of heart disease, type 2 diabetes. Also can cause slower healing times as well. And there's also a link there between depression and anxiety. So therefore, if we can have a healthier diet and perhaps manage our weight, we can reduce the risk of all these other comorbidities.
So medication, diet and sleep. So we're going to expand on the effects of medication and sleep on the next few slides. But just looking at this slide here, we can see that if you've got increased pain, you're likely to increase your medication. Medication can affect your nutrition, and again, that can lead to poorer nutritional intake, which again can increase pain. So a bit of a vicious circle there. And with sleep, we all know that pain can affect our sleep. Poor quality of sleep affects your appetite hormones, and poor quality of nutrition, increased weight, and if therefore again increased pain.
So looking at diet and sleep now. So people suffering from pain often struggle sleeping. This can lead to irregular eating habits. So you might find if you're kind of up late at night, you might find yourself eating more snacks through kind of quite late at night. Sleep is an important factor in helping to regulate your hormones. So the two hormones which sleep has the greatest impact on are called leptin and ghrelin. So leptin is your stop eating hormone, and ghrelin is your hungry hormone, so it tells you when you're hungry. So poor sleep can have an effect on both of these and therefore can lead to an increase in appetite. It can also affect your glucose tolerance and insulin levels, which can lead to an increased risk of diabetes. Also, when we're tired, we might make poorer food choices. So, for example, we might be too tired to plan our meals or too tired to cook, so may choose things that are slightly easier, such as takeaways, which obviously don't have as good nutrition content. So caffeine as well. So caffeine is a stimulant. People often try and use caffeine to help them stay awake during the day. So if you've had a particularly bad night's sleep, you might turn to the coffee. As it is a stimulant, it stimulates cortisol and adrenaline. And you can have a think about this and link this back to your fight and flight, which will be in your explain pain talk that you'll do with one of the other physios. Alcohol. So people often use alcohol to try and help them go to sleep. We will discuss this in a little bit more in the next few slides, but alcohol affects REM sleep, and REM sleep is important for good quality sleep. So often you might find you get stuck in this vicious cycle of increased pain, poor sleep, poor nutrition, which can then cause weight gain. So people who sleep less than 7 hours a night are at higher risk of becoming obese.
So looking a little bit more at alcohol. Alcohol can also have an effect on weight. It can be really quite high in calories. Guidelines advise a maximum of 14 units a week. So just having a look at how many units are in 1 pint of 2.5% lager. That's 3 units. How many units are in 175 milliliter glass of 14% wine? And that is 2.4 units. That's equivalent to 1 Cadbury mini roll, or 4, and there's 4 glasses of 175 milliliters in a bottle. So if you're going to drink a bottle of wine, you're going to be eating 4 Cadbury's mini rolls. A pint of 5% beer is the same as a packet of McCoy's salted crisps. And it may not seem a lot, but on regular occasions, these calories will add on. And we need to remember that these are empty calories. So these extra calories you're taking in when you're consuming alcohol don't actually contain any nutritional benefits at all.
Okay, so now looking at medication and diet. So medication can affect your nutritional status. There are some evidence to say that medications can affect your absorption of certain vitamins and minerals. The worst offenders probably are gabapentin and pregabalin. We found that almost all of our patients taking, or research has found that almost all patients taking gabapentin have put on weight, and unfortunately it can be a significant increase in weight. This then leads obviously to increased pressure on the joints, which then can lead to increase in pain. Other medications such as duloxetine, this can cause nausea, and again that may make you feel not like eating very much, which can then have an effect on your nutrition. Other opioids as well can cause constipation and abdominal pain, which again may have an effect on what you choose to eat and how much you're eating.
It's worth noting as well that high dose opioids can actually increase pain. So if you've been on high dose opioids for a while, then it's definitely worth considering whether we can lower the amount that you're on.
Okay, so
you go for it, Rachel.
Dieting. So there are a couple of different diets. So there's you might have heard of them, the 5-2 diet, the ketogenic diet, the low FODMAP diet, and probiotic diet. So just to briefly explain them, the 5-2 diet is where you have 2 days a week where you eat lower calorie foods. The ketogenic diet is a extreme low carbohydrate diet. Low FODMAP, you cut out specific carbohydrates for 4 to 8 weeks. And the probiotic diet is eating foods that are particularly high in probiotics for gut health. Now, most of the diets involve cutting carbohydrates. However, these are our main source of fuel for movement, for exercise, and just for general metabolism. So in order to burn fat, we would need to be completing a low to moderate intensity aerobic exercise for a longer duration of time in a specific heart rate zone. What we've found with kind of these diets are it doesn't allow you to consume all the nutrients, doesn't allow you to consume all the food groups. And each of the food groups have particular benefits for nutrition. And again, we'll go on to those in a minute. The research also suggests that these types of diets are not beneficial in managing pain long term. It can lead to yo-yo dieting, cravings for food which you aren't allowed, and they may work for some people to maintain weight, but those who are successful need extremely high levels of motivation to keep this going. Otherwise, as I say, you might find yourself yo-yo dieting. So you go onto one of these extreme diets, you lose some weight, and then you start eating how you were again, and then you get stuck in this vicious circle.
So looking at mood, diet and pain. So there's been a number of studies that have been carried out that show links between mood and diet. So in 2010, Macmillan carried out a 10-day Mediterranean nutrient-rich diet versus no change diet. So they got half the population to have a nutrient-rich diet for 10 days and the other half of the population just ate their normal diet. Although it was only a really small study and it didn't have a long-term follow-up, there was just 25 adults included in this study, but there was shown significant improvements in self-rated vigour, alertness, contentment and mood with those that were having a nutrient-rich diet. There's also links with diet and depression, links with anxiety, and certain food can sort of trigger moods. So sometimes high sugar, then you have a sugar, all your sugars decrease and you can feel quite low in mood. And some people also find they have a lack of meaning around meal time. So feelings of isolation can lead to an intake of lower dietary quality, increased comfort eating and lack of meaning around meal times. You might get short-term emotional benefits, so chocolate releases endorphins, you might get a sugar rush, and again, like I was talking about, that later can lead to mood swings due to blood sugar fluctuations and nutritional imbalances.
Okay, so moving on to malnutrition. So malnutrition is not just defined as being dangerously underweight. It's also can be what is called protein energy malnutrition, which is the wasting, or it can be classed as being overweight or obese, or it can be weight gain with a decrease in muscle mass. This is called sarcopenic obesity. And just looking at this diagram here, you can see that experiencing pain can lead to decreased activity, which can lead to kind of your muscles weakening, which can then possibly lead to a fear of pain and activity avoidance, which some of you might be able to to link to at the moment. But we just wanted to highlight that malnutrition isn't just a case of being dangerously underweight.
So looking at sugars, you might want to pause this talk for a minute and copy in this into your browser. So this is just a quick, short 2 or 3 minute clip that's filmed by the British Heart Foundation, and it's really useful at looking at what free sugars are. So free sugars, if you haven't had a chance to read it, are those sugars that aren't contained within your food. So you would have sugars that contained naturally within fruit, but once you've broken that fruit down, if you've turned it into something else, if you've turned it into a smoothie, or when people make chocolate and things, that contains these free sugars, and those are the ones that aren't as good for you, so they're not as naturally occurring. So just looking at sugar, so how many teaspoons of sugar are there in these food and drink? So you might want to grab a pen and just have a guess of these as we move through. So you've got 120 gram slice of carrot cake. How much sugar do you think's in that? So 10.5 teaspoons of sugar in a single slice of carrot cake. 120 gram slice of flapjack. How much sugar do you think's in that? So we've got 9 teaspoons or 9 sugar cubes in a slice of flapjack. 45 gram bowl of frosted cornflakes. So you've got 3 teaspoons of sugar in frosted cornflakes. 200 gram portion of baked beans. So 2.5 teaspoons of sugar. It's worth looking at the fact there might be sugars in things that you might not expect there to be. And 1 tablespoon of ketchup. And that's got 1 teaspoon of sugar. And then looking at alcohol, which we mentioned briefly earlier, so 1 pint of sweet cider. You're going to be having 6 teaspoons of sugar for every pint that you have. Pint of beer. That's a little bit better than cider, but still 4 teaspoons of sugar in a pint of beer. And this diagram's just going to have a looking at a couple of things to illustrate. People might drink cans of Coke in the day. It's got 10 sugar cubes in it, so you might want to think about replacing that with Diet Coke. Just having a look at a Starbucks coffee. So sometimes we might treat ourselves to a nice sweet coffee, but actually there's 23 sugar cubes in a Starbucks caramel hot chocolate, which is actually an extortionate amount. There is a Sugar Smart app, so you can look it up, and that can easily be used to track the amount of sugar in common food. So that's sometimes worth having an explore, just to help you to find out what foods that are quite common might contain more sugar than expected.
So our take-home message from the first part of the presentation is that a poor diet can lead to increase of pain.
Okay, and we've got a food quiz here. So what we'd like to do, this is the end of this this slideshow, but what we'd like you to do is, in your own time, just to copy that link and have a go at completing the food quiz. Try to answer all the questions as honestly as possible. It's only going to take 5 to 10 minutes to complete it, and it's free to complete it. And then it will just give you some tips for improving your own personal diet, and we can discuss what changes you can make to your diet later. We really like this quiz because it gives you a score on how healthy your diet is with tips on how to improve, and then obviously you can repeat it later to see whether you're meeting any of that criteria. It helps to focus on getting you to eat more healthily rather than focusing on what you need to cut out. And although it's based on Australian guidelines, so it is an Australian quiz, the Australian government guidelines for healthy eating are really, really similar to the guidelines we have here in the UK. So have a go at completing that quiz. And then if you want to join us for the second education session on nutrition, we'll have a little bit more of a look at what changes you can make that could potentially help to decrease your pain.